An important new study looks at why the pandemic has disproportionately impacted minority communities. Now, joining us to discuss this groundbreaking study are LaRon Nelson, Professor and Associate Dean at Yale, and Bob Genter, President of the Defense and Civilian Sector of SAIC, a respected Fortune 500 company that provides services to government organizations like NASA, Homeland Security, and Health and Human Resources. LaRon, Bob, thank you for joining us on Morning Blend.
Our pleasure.
Now, LaRon, please tell us about what the study uncovered in regard to the challenges minority communities face as a result of the pandemic.
Yeah, well, we found that there were three main challenges. The first was in access. The COVID-19 vaccine was not always available where people wanted to receive it and when they were ready to receive it. So that was a big challenge. The second was in language and communication. The communication, as you probably know and the audience knows, was not the best, in addition to how inaccessible sometimes the language could be, particularly for Spanish-speaking communities. If that info was not available in Spanish, folks could not always understand it, and then couldn't always trust it, and which is the third one. There was a lot of mistrust in the system that we had to rely on for this response. Communication systems, health systems, and even distribution systems. So those really were the three things that we found that complicated this response for Black and minority communities.
Now, Bob, tell us more about SAIC and why the company commissioned the study.
Sure, yeah. SAIC is a 25,000 person government solutions and services company. We do work in IT, in technology, engineering, and supply chain and logistics. Our people love to understand how they're impacting their communities and the work that they do for our government customers to make sure that we are getting to a final solution and not just getting through activity. So as a values-driven company, we wanted to make sure that we understood what we could bring to this and understood what that final solution was, as opposed to just the activity of getting things into a location. It was about looking at the system overall and making sure it was effective and efficient.
Now, LaRon, are there other key findings from the study?
I would say the additional key finding is that there is a lot of capacity in communities to contribute to responses in ways that we really did not utilize well in this current pandemic response. We should see communities as the ability to partner in responses and not just be subject to these types of responses. Bob's point about SAIC being a values-driven company, I think we can also tap into the values that communities have who really want to be part of these solutions. We've just not always appreciated that they can, but they can.
You know, Bob, speaking about supply chain, we did have a problem with masks and hospital gowns and equipment. Have we learned anything from this?
Yeah, I think that's the answer, right? Is it's looking at each one of these things, the holistic system from finding where it is, getting it to where it needs to be done and it's then utilized in a way that is useful. So when LaRon talks about access, language, and trust, it's not just about dropping a box on a doorstep. It's understanding how it's going to be used, who's going to use it, what the volumes are that are there, and understanding that holistic thing. It's not just, again, about placing something somewhere. It's about making sure that it's efficiently used after it's there.
Mm-hmm. Now, where can our viewers go for more information?
SAIC.com/COVID-19 research.
Gentlemen, thank you so much for joining us on Morning Blend. LaRon, it's very interesting what's going on in the African American community as far as finally being noticed or recognized for lack of resources that we have. Do you think we'll ever, or the government will ever catch up?
I think there is hope that it could be possible. I mean, part of what we did in it was because SSE commissioned the study was to provide the evidence to say we know what can be done. And so we hope policymakers will be able to use this evidence to make different decisions about how they resource communities, because people are doing it, but they're doing it on a shoestring because their capacity is not recognized. I think this can show that the issues are largely structural, and we can do a better job if we recognize and also invest in those communities as partners.
Thanks again, LaRon. Bob, thank you again.
Thank you.
Thank you.